Hey there, it's Dr. Jim. Thank you for stopping by for another health and wellness topic. My topic today is health promotion and disease management, and I'm going to take a bird's eye view, a macro level, or a big picture view of this particular topic. So, people are living longer and longer in the United States and around the world, and that's a wonderful thing in and of itself. I want to live long, but I also want to live well. Okay. With advanced age, if we're going to be completely realistic, and we're taking like a population view right now, advanced age can bring a lot of chronic illness, disability, loss of function, greater independence, more economic and financial strain, Medicare, Medicaid, so on, insurances, so on and so forth. So if we're going to help individuals within a given population here in the United States, in the UK, in South Africa, in France, Canada, wherever a population of aging people might live, we have to take a look at two things: health promotion and disease management. So what do I mean by health promotion? Health promotion is meant to be applied to an entire population of adults. It's aimed at engaging and empowering individuals within their own communities to make better choices. We always hear that. Live long, make better choices, live better. So we want to help individuals make better choices concerning their health and their wellness. And by doing so, they decrease risk of developing chronic illnesses, and they can live longer and better quality lives. Just don't live long, live better quality. Maximize the quality of your life. Examples of health promotion programs can be found in large retirement communities. If you've ever gone to the villas, the villages, and all those other places in Florida, and I have been down there, and they are very fun and interesting places. And we have these retirement communities scattered all over the United States, as well as community centers and services within cities and communities. They've got programs that focus on certain things. So here are some examples of health promotion interventions. In general, health promotion interventions include health education, behavior modification, and health communication. Those are three biggies. Such interventions aim to promote active, healthy, productive, and positive aging. Examples of health promotion interventions include the following: support groups, social networks, environmental services, community strategies, economic support, and of course, health policy. So, we have got to talk about not only health promotion at this major level, but disease management. Okay. Disease prevention can be successfully paired with health promotion to achieve better health outcomes. It differs from health promotion in that it focuses on specific efforts to reduce both the development and severity of chronic conditions and related illnesses. In other words, it strives, disease prevention strives to avoid diseases and their consequences among older adults and seniors. It also attempts not only to avoid these things altogether, but a lot of older adults are already sick. They're already diagnosed with something. So it also attempts to slow the progression of many illnesses like Alzheimer's, Parkinson's, diabetes, and cancer. And of course, cardiovascular, vascular, and all the other major leading causes of death in the United States. We want to slow those things down, hopefully prevent them. Disease management interventions are important to know. And if you work with seniors who might be living at home, they need extra help, they need more education on improving their own health and well-being, these are good things to talk about. So in order to accomplish prevention or slowing down a condition or two, a number of interventions can be employed, including the following: promoting physical activity and exercise, move it or lose it, addressing the issue of frailty, or something we're looking into more in gerontology, pre-frailty. It's almost like diabetes and pre-diabetes. Working to improve cognitive function, addressing mental health needs and emotional needs, improving diet and nutrition, enhancing sleep quality, and addressing any addiction, substance use, substance abuse, misuse, call it what you will, issues. And yes, older adults and seniors can have addictive problems. Here are some determinants of health to think about. Determinants of health influence modifiable risk factors associated with poor health. Health promotion and disease management programs address such determinants, including things like social, cultural, economic, and even political conditions where people live, which affect their health and their well-being. Think about it this way. Realistic example. Growing up in a, pretty, say, well-to-do suburban area in the United States, you have certain opportunities. There are grocery stores with fresh foods and whatnot, and healthcare services are not that far away. In other words, you have resources right here for the most part. If you live in far out rural areas in America, or if you live in really deteriorating inner city areas, you may not have access to those things. If you live way out in the countryside in India or Africa, you probably don't have the same quality of services, physicians, healthcare specialists, types of foods, medicine, so on and so forth, care. So where you're born really makes a difference, okay? These modifiable risks addressed by health promotion and disease management include the following things: a lack of physical activity, using tobacco, excessive alcohol use or prescription medications, poor nutrition, okay? So here are my final thoughts before I go. People are living longer here in the United States and around the world, and that's a great, great thing. But increased longevity brings the risk of more chronic and debilitating illnesses, which can strain resources and lead to poor health outcomes for the aging individual within that aging population. It's imperative that we take a big picture look and examine how health promotion and disease prevention can reduce such risk and lead to better quality outcomes by directly improving determinants of health. That's the sociology person in me, I guess. I had to step back, take a look down into a population and say, if we're going to age well, we need to take a look at a couple things: health promotion and disease management, as well as the determinants of health. I'm Dr. Jim. Thanks for stopping by. Keep coming back for more information and keep trying to live your best life. Thank you for your time. I hope you enjoyed the video. And if you'd like to learn more about our products, you can find the link to the website in the description. And I'd also like to give you a coupon code if you'd like to try some of the products. For your first purchase, use the code YouTube to receive 20% off your first purchase. I hope you enjoy the products.